A lot of people say, Dave, I'm a little fuzzy on this whole brain fog issue, but yet you complain of it and you know exactly what it means. It means your brain don't work. It takes many, many different forms, right? I have trouble concentrating. I get distracted easily. People ask me, are you even paying attention? Hello, I'm talking to you. Who knows where you're at? Also, in terms of executive functioning, now that's a fancy term. What does that mean? It's really decision making. And moreover, it's the ability to top-down regulate uncomfortable emotions coming from deep limbic structures, right? And that would be, oh my gosh, I'm going to die, everything's a catastrophe. You keep going down these rabbit holes, everything refers back to you, I'm unworthy, I'm ugly, I'm fat, whatever it is. Then this part of your brain that overrides that and says, shut your yackers, deep amygdala structures, striatum. You can't do that, right? So that's that executive function. That thereby prevents you from problem solving and making important decisions. Okay, at the same time, you can't control that anxiety. Your fretfulness, your worry, and almost all of your energy is tied up into, right? That's a brain fog phenomenon. Okay, well, what causes that? That's usually a sign of neuroinflammation. I often also see low energy. I'm exhausted from worrying so much. I can't override that. That mixed, wired, and tired profile I talk about so much. Your body won't go, your brain won't stop. Simultaneously, you're not enjoying life, right? There's very little joy in Mudville. Whenever I see that, that's inflammation. And inflammation is usually what's driving your brain fog. Where does that inflammation come from? It always comes from the gut. Sometimes it can start in the brain and then go to the gut. That's that old gut-brain axis that you're reading, and I hope more and more about. I started lecturing on the gut-brain axis back in 2011. It's been that long, and I've researched it extensively, and this is why I'm so confident when I tell you, your gut ain't working if your brain ain't working, right? Leaky gut, leaky brain. Well, Dave, how do you even diagnose brain fog? Is it even a thing? It would be an example of what I've talked about before, one of those trans-diagnostic symptom domains. I see brain fog in every diagnosis I treat. Depression, ADHD, anxiety, substance, it doesn't matter, right? So I'm not treating any of those things. I'm going upstream and I'm identifying what is the unique cause of your particular brand of brain fog. And then that's where I'm going to intervene. Test I use a good blood panel, a CBC, a lipid profile, full thyroid cascade. I'm going to get a measure of systemic inflammation, usually a CRP. I want to know what your insulin's doing, so I'll get a fasting insulin. The real payoff for me, however, and clinically significant and informative test would be my neuroadrenal profile, which would be 1 urine and 4 salivas. 1 urine, I make up my own moves, 4 salivas the same day, and that's going to tell me what your adrenals are doing and then also what your neurotransmitters are doing. I love this test. It's worth the investment. Start a little savings fund because I'm going to want you to get that, ideally even before we meet. What do I do about that? I am going to incorporate my same unified theory of diseases of civilization and my core 6 treatment strategies. I'm going to start by sealing and healing your leaky gut. I'm going to resuscitate your presumably tired adrenals. I'm going to right-size inflammation. I'm going to balance neurotransmitters. Now, I don't know if your brain fog is associated with too much in the way of excitatory neurotransmitter tone, dopamine, glutamate, norepinephrine, PEA, right? Because that could cause you to be distracted and anxious and worried and just plumb cray-cray, okay? That's a technical term, cray-cray. Or is it that you lack the proper inhibitory neurotransmitter tones? I'm going to then support detoxification pathways, because if you're inflamed, and that's the presumption if you have brain fog and lethargy, okay, then you're creating a lot more toxins internally than you can get rid of, hence oxidative stress. I'm going to support how we get rid of all of that stuff, and then I'm going to promote your mitochondrial health. That's your powerhouse. Okay, hotshot, how are you going to accomplish those 6 things? Well, I'm glad you asked. First, I'll reset with probably 2 weeks, maybe 3 weeks, my OptiTox GHI, a meal replacement protein powder, and it's going to give you everything you need for your rest and digest system to seal and heal that leaky gut. So it's a very good first step. Secondly, I'm going to give you a product called Leaky Gut Repair. You're going to get a good probiotic, you're going to get vitamin D3, you're going to get fish oil. Depending on what your testing results show me, you're going to get some significant adrenal support, you're going to get targeted amino acid treatment. So that's kind of my approach. Side effects. No, I don't expect to see any side effects. Keep in mind that you're more likely to have an adverse event with a medication 60,000 times more likely than with any of these supplements. I trust the safety and I see that they're very well tolerated. How quickly can I expect to see results? Real quick if we get it right. I expect focus, concentration, motivation, get up and go, vim, vigor, and vitality to get better quickly. And why that's important is I'm going to be asking you to change your evil ways, and you know what I'm talking about. I'm going to be asking you to get more active. Go ahead and get your 8 hours of sleep. Clean up your diet. Smooth your relationships. Have a good belly laugh once in a while. Shoot, have an orgasm. I don't care. But we're going to get you back and join the world of the living. You know, get your zest back. All of that good life force stuff back that has been lacking for so long. You know what I'm talking about. Can and how do I combine the mainstream medical strategies with these complementary, alternative, integrative, functional, what have you strategies? Yeah, I do it all the time. My practice is called integrative medicine, integrative psychiatry, because that's exactly what I do, is I try to combine the best of each world, not only then to enjoy the synergies with respect to efficacy and effectiveness, at the same time hopefully get by with less medication. Very surprised, however, at how few people integrate these different treatment modalities. Your brain is not working properly, right? You got your brain fog, you're having trouble making decisions, you don't even sometimes recognize yourself. But do not settle for this, right? This is not who you are. You're not stuck with this. There is a lot of help. I treat this all of the time, and I would love to mix it up with you. If you think this approach is for you, if you think you can tolerate working with me, then give me a call. There's the number. We got to get started, however. This is not going to get better on its own. I want a better. I want you better than you've ever been in your life, even before these symptoms started, so that you can pursue joy more effectively and hopefully live a long and happy life. All right, give me a call. Until then, peace out.